Welcome to session 6 of the PneuBack program level 1. In this session, we will be going through the unweighted back chair along with the upper angle adjuster. Please ensure that you have completely reviewed the manual regarding this session prior to listening to this webinar and have your manual available to follow along as we go through the sessions in this webinar itself. When we begin, what we will be talking about is primarily the components of the PneuBack chair and its important parts. The most important parts to keep in mind include the seat angle adjustment right down in this area. This will be utilized and raised if the original PneuMap tells us to flatten the seat angle. If it does not say flatten seat angle, then keep the riser adjustment in the down position as you see here. Other important components include the belts that are here. There is a belt that goes around the waist. This is a belt that goes around the thigh for the restraint. And these are thoracic stabilization bars, belts that are utilized. So ensure that when you put the patient and you stabilize them, that the belt is actually pulled nice and snugly around the patient, as the tighter you can do this without causing pain for the patient, the better they are stabilized and the better and more effective the exercise becomes. Another important piece to be aware of here are these knobs on either side. There's one here and there's another one on the other side. These are what we call stabilization pins, and on the PneuMap itself, if it says place the patient into pin position number 4, this is where we will unclick here, unclick on the other side, and there will be numbers along the back here that we will put that will correspond to the PneuMap itself. Before putting a patient onto the chair, please ensure that you have the stabilization bar moved all the way down and the exercise pad placed all the way on top of it, again down to the very bottom here. This will be more comfortable for the patient as we go through the neutral pelvis exercises. We recommend that the clinics purchase a small step stool if they have two, one that can go on either side of this bar, as it will make it easier for patients to step up and into the chair to sit down before their exercise begins. Also, we also recommend that patients or that clinicians keep in mind the height of their patient. If the patient is less than 5'4", that a pad may need to be placed on the seat itself to bolster the patient up so that they're a little bit higher. And the key to doing this then is we want to make sure that the stabilization pad, when it comes down in its lowest position, lines up with roughly L5 on the patient. The final important piece here to keep in mind then is the control panel, as through the control panel we will be utilizing and controlling the air pressure for not only the foot plate but the stabilization component and the lumbar component here for stage 1. Keep in mind that the PneuBack chair is actually placed underneath an unweighting system with the angle adjuster, and although it's not shown in this picture here, the angle adjuster will sit right up on top. Make sure that the center, when you have the angle adjuster not in either position to the left or the right or forward or backwards, is actually lined up directly above the middle of the chair. So from the middle here straight on upward is where the middle position or the neutral position for the angle adjuster needs to be. In this respect, we can make sure then that once we utilize the angle adjuster to pull a person into flexion or extension, that we're actually getting full extension, full flexion out of the traction that we are going to be doing. When we start looking at the stabilized unweighting component and utilizing the unweighting chair, there are a couple of important things that will help us to determine what we need to do for this patient. And the 4 important things are primarily: 1, patient tolerance, meaning that you want to make sure that you can put a patient into the chair without them feeling pain. So if they're sitting in the chair and they start to feel pain, we want to make sure then that that is not something that continues as they are brought into traction as they go through the work. Second thing is that our initial evaluation will tell us what needs to be done. So for example, if a patient has a disc herniation, we will know then that as we go through the stabilized unweighting with the patient, it will be very specific as to how we will do the traction and the type of neutral pelvis exercise that will follow. The third thing is what we're trying to accomplish in level 1. We're primarily taking patients who are in acute or chronic pain out of pain, and that's the purpose of level 1. In level 2, what we're trying to accomplish there is we're going to be taking patients with who are now out of pain and start working on fixing things like posture. So what we are trying to accomplish is important as well. Finally, the patient's presenting posture, and this is something that essentially we can determine by the new map, the initial map printout that we started out with. The important components on that map then are: one, are we going to need to utilize a flattened seat angle or not? And two, what number we need to put that back chair in. So it will tell you something like position pin number 4. If a patient tends to lean forward a lot or has a forward lean, then it'll try to pull them into a backwards lean. But when we're putting a patient onto the 8-minute distraction time prior to starting the neutral pelvis exercises, the map becomes extremely important. So remember, every patient needs to be mapped on their first visit. So if that has not been done, please go back and ensure that a posture map is done for the patient prior to coming onto the PneuBack chair. When we are utilizing the PneuBack chair, there are 3 main things that we're trying to accomplish when we place a patient on there. The first thing is by doing an unweighting in a stabilized position, we're maximizing the ability to take pressure off of the facets, off of the discs in cases of stenosis, off of the nerve roots, any type of chemical irritation. We are primarily focusing on unloading the joint. The second thing that we utilize the unweighting chair for then is something known as reciprocal inhibition. And what reciprocal inhibition does then is that if we can stabilize the pelvis and fire the abdominal muscles, we will actually end up relaxing the antagonistic muscles of the extensors in the back. So oftentimes when patients come in who have chronic or acute back pain, you'll notice that there's a lot of muscle spasmings, a lot of tight muscles in the back. By utilizing reciprocal inhibition, we're able to, by firing the front muscles, relax the ones in the back. Finally, what we're trying to do is we're going to accomplish some active mobilization. So by stabilizing that lower back, doing the neutral pelvis exercises, we're actually going through a process where we're going to be initiating the idea of immobilization, again furthering things like circulation, enhancing fluid flow within the lower back, and by doing the neutral pelvis type exercises under an unweighting type environment, we can actually reduce the amount of disc bulging by initiating the billows effect, where there's almost like a pumping effect where the movement itself will help to bring in any nuclear material or reduce the wedging or the bulging of the disc. Again, the billows effect, remember, is very similar to what McKenzie says with the McKenzie extension exercises for disc herniations. When we put the patients into the chair, it's relatively straightforward. However, these specific steps need to be followed, and you need to keep a particularly close eye on the patients to ensure that they feel minimal to no pain or discomfort as we're going through the setup, and particularly as we're going through the unweighting and the exercises. So again, just as with every other piece of equipment, pain is not something that we would expect a patient to experience while they're in this piece of equipment. Now, to get the patient up and into the chair, then the most important thing is to start off by ensuring that they're actually wearing an unweighted harness. So something like our sports vest or our vector vest will work very well in this chair. If you came from taking the patient off of the unweighted treadmill, which is the step previous to this, just keep that harness on the patient. To get the patient up and onto the chair then, remember the step stools we recommended that the clinics get. Have the patient step on the stool and then sit back into the chair. First thing is to make sure then that the patient is pushing themselves all the way back up into the chair so that their sacrum is snug with the back of the chair itself. Once the patient is there, then utilize the vest strap, put it around the patient, and again, nice and snug is usually the most comfortable for the patient. It's also going to be the most effective for us, so don't be shy. Pull that belt relatively tight. So long as the patient does not feel pain when you're doing it, and they don't feel pain after you Velcro the strap down, the tighter you have it, the better it actually feels for the patient. Have the patient then lift their feet up and off of the stool and onto the foot plate itself. We recommend putting about 20 to 25 psi in that stabilization knob. As the foot plate comes up, have the patient keep their feet in there. As it goes up to about 20-25 psi, it will cause the patient to flex and bend the knee. So what we would recommend at that point in time is that if it comes up, then that is fine. We recommend putting in the knee bolster to keep the knees from banging into one another, but ask the patient to lightly push the plate down until their knees are straight, and then put the thigh belt around, and again, nice and snug. Once you have the thigh belt around the patient, then you can go ahead and relax, have the patient relax, and the thigh belt will keep the knees from popping up as the pressure is put into there. If the patient tends to hyperextend the knee, it will be okay for us to keep the patient into a mild flexion, but a general rule of thumb is that the straighter we can keep the knee, the more difficult it will be for the patient to recruit, particularly the quadriceps, as we're doing some of the exercises and the neutral pelvis work. Okay. So in this slide, we're just continuing on with the way that we would strap the patient. Once this is done, the patient is stabilized, we're going to ask you to go ahead then and clip the vest to the angle adjuster up above, and you're ready to set the angle adjuster and start the patient on the neutral pelvis exercises. Now, what we've done for this section then is that, remember, level 1 work is designed primarily for patients with the disc bulges and disc herniations, along with people with a spondylolisthesis and patients with central disc bulges. So these are the types of things that we're going to work on, but we also have a way of utilizing the stabilized unweighting for patients with lateral leans or sways to one side or the other. So what we're going to do at this point in time is we're going to go through the specific scenarios as to how we would adjust the angle adjuster for the particular problem that your patient might have. So patients who come in may have more than one problem, so let's go after one problem at this point in time, whichever one you feel is their largest problem. So for example, if a patient comes in with a central and a right posterior disc bulge, we will go after the one that causes the most symptoms. So if they have a central disc bulge and a right posterior disc bulge at, say, 2 different levels, and they're feeling more pain down the right side at the level of the right posterior disc bulge, we will start with that one, get that up and out of the leg, centralize that problem before we deal with the central. So when we're looking at the pictures as we go through these scenarios, you'll see that there's a picture right here on the right-hand side. The important thing to keep in mind is to have a frame of reference, and the frame of reference is that this is the right side, and what you're looking at as this bar is the closest towards you. So this is the back half. Right here, we're looking at the, right here is the back half of the angle adjuster. This is the right side. Okay, so it's almost like you're standing and looking at the back of the patient. So the patient will be sitting in a chair right here, and their back will be towards you. Okay. First thing that we're going to do then, when we hook the patient up onto the right posterior with the right posterior disc bulge, looking to do the reciprocal inhibition exercise then, is that we have them set up in the chair as we described earlier, pull the ankle adjuster in whatever position it is without any weight bearing, and clip the vest to the angle adjuster. At that point in time, we want to loosen the angle adjuster and pull it all the way to the far right-hand side. Okay. Once we have it in the far right-hand side, now we need to pull the angle adjuster all the way back, and this is all the way back here, at which point in time we will clip the lock and it will lock into position. What we want to do with the right posterior disc bulge then is we want to open up the left anterior portion of the disc. So as we pull this patient, we want to almost pull them into extension and to the right side. Okay, so we can open up the left front portion of the disc itself. Okay, as we start to unweight the patient, make sure that they feel no pain and no discomfort in the position you have them in, and slowly start the traction, and again, make sure that they feel no pain or discomfort. Once a patient can feel pain, or once a patient can feel traction while they're sitting in the chair, that's where we need to put it. In most patients, you're looking at anywhere between 30 to 50% of their seated body weight before they can start to feel the traction. Make sure that the patient feels absolutely no pain, and as you go through the 8 minutes of static traction, that there is no pain that starts up on the patient. If the patient starts to feel discomfort, say after 4 minutes of traction, you can slowly let off the weight, again making sure until they feel no pain and no discomfort. If you're unable to reduce the discomfort and it gets more, then we just go ahead and slowly release the patient. Do not let the air pressure out all at one time, but slowly let it out until there's no traction and take the patient off of the chair. If there's no pain or discomfort and you've been able to do static traction for about 8 minutes, the next step then is to loosen the chair. And what we mean here are, remember the 2 pull pins on the back of the chair that we said were important at the start of the webinar? Those 2 pins need to be unlocked so that the back half of the chair can move. Then what you will need to do is you'll need to go to the control box and give pressure to the area that says lumbar. Slowly increase the pressure so that the pressure is just enough to keep the chair back from flopping backwards so that it's actually up and on the patient. The instruction then for the patient to do the neutral pelvis is actually 2 motions. One is they need to suck in the stomach, keep the stomach flat, and the second is that they're going to push their lower back out and against the back of the chair there. As they do that, you'll see a very characteristic rocking movement of the chair itself, and as it pulls back, we ask the patient to hold for 5 seconds, and then they will relax into that to make sure the chair has enough pressure to follow the patient back, and they're going to repeat this 12 times. Now, in terms of the amount of pressure that the lumbar portion of the chair needs to have, minimal pressure, just enough pressure to keep that back from dropping out against away from the patient, so that the back of the chair is actually touching the back of the patient. So just enough pressure for that. So remember, 2 distinct motions. First one is to suck in the stomach, hold the stomach sucked in, and then push the back against the chair. You'll see the characteristic rocking. Hold that for 5 seconds and repeat that 12 times to do the reciprocal inhibition exercise. Once you have finished this, then you can go ahead and lock the pins again, take the pressure off of the back portion of that chair, and slowly unweight the patient, and then let them up and out of the chair. When a patient comes up and out of the chair, avoid any quick sudden movements. Help the patient whichever way you can to come up and out of the chair. They should not be feeling any pain or discomfort after they come out of the chair or any time during the exercise itself. If we're dealing with a patient with a left posterior bulge, the only difference from what we described then is the way that we would move the angle adjuster. In this position, in this condition with the left posterior bulge, we have a disc that's going out the left back side, and they're bulging out of the disc in that quadrant. So what we want to do is open up the right front side, and the way of doing this then is that once you have the patient in the unweighted chair, we want to pull the angle adjuster so that it's pulled all the way to the left side. So remember, you're looking from behind. This is the left here, and you want to pull it all the way back so that we can bring a patient into extension, again, to open up the front right side. Once we have that in there, make sure that the patient is clipped to the spreader bar itself, and slowly unweight the patient. Again, we're going to unweight about 30 to 50 pounds to the point where the patient can actually feel the distraction going on. In this case, more is not necessarily better. The important rule of thumb is to ensure that the patient feels no pain, no discomfort as they are seated in the traction. We will then hold the patient in static traction for about 8 minutes, again checking in with them periodically to make sure that there's no pain, no distraction. Once that is done, then we will go through the process again, whereby we're going to unhook the pull pins on either side of the chair, turn the knob that's labeled lumbar so that there's just enough pressure to keep the chair up and against the patient's back. At that point in time, remember, there's 2 motions: suck in the stomach, hold the stomach sucked in, and then push the back into the chair, and you'll see a characteristic rocking of the chair backwards. Hold that for 5 seconds, and then relax and repeat that 12 times. Once that is done, go ahead and lock the chair back in and release the pressure, again under the regulator that states lumbar, and slowly unweight the patient and help the patient up and out of the chair, avoiding any quick sudden movements. When we're looking at a patient with a right lateral shift, in this case, then these patients are the ones that kind of they lean off to the right side. So you can kind of see these patients when they come in where they almost seem like one shoulder's lower, or they're visibly leaning off to the one side. What we would do then with this patient then is we want to go the opposite of this, in which case then we would take our angle adjuster then, and we would move the unit all the way towards the left side. So again, remember, for our orientation, we're looking from behind. So we want to pull this pin here, move that all the way to the left side. The pin in the middle, we want to keep the pulling point right in the middle, so there's no forward or backwards lean to the pull. No flexion, no extension. Again, then what we would do is make sure the patient has no pain or discomfort in the position, hook them up to the spreader bar, and slowly unweight the patient about 30 to 50%, ensuring that there's no pain or discomfort. They hold that traction for about 8 minutes, and once 8 minutes is done, then what we would do is we would start to go through the reciprocal inhibition neutral pelvis exercises, where we will again hook both sides of the pins and put enough pressure in the regulator that's labeled lumbar to keep the chair up and against the patient. And remember, when you unhook the pins, the chair will flop, so hold on to the chair while you're increasing the pressure to the regulator. Once you have it so that the chair is right up against the patient and not pushing them forward but not falling away from them, ask the patient to do 2 motions. Take a breath in and suck in the stomach at the same time. Hold the stomach sucked in, and then ask them to lightly push their lower back up against the back of the chair. You'll see that rocking motion. Again, hold that 5 seconds. Repeat that for 12 repetitions. The left lateral shift is similar to the right lateral shift. Again, now all we're doing then is, if a patient leans to the left side, we want to pull them off to the right side, making sure that there's no pain or discomfort during that process. What we're going to do with the angle adjuster is we're going to go ahead and pull this pin out and pull it all the way to the right side. So this is the right side. Keep this pin here straight in the middle, so you're not leaning to the back, you're not leaning towards the front at all. When the patient is attached to the angle adjuster and has been belted to the chair as described earlier, increased traction, again 30 to 50% of body weight, or until patient starts to feel traction. Ensure there's no pain, no discomfort. Have the patient in traction for about 8 minutes, making sure that they feel no pain or discomfort during that time. And then what we would do is we would go into doing the neutral pelvis exercises. Again, do the 2 pull pins holding on to the chair, adding pressure on the regulator that's called lumbar until there's enough pressure on the chair so that it's just sitting up against the patient without pushing them forward or falling away from the patient. Ask the patient to do 2 motions then. One is to suck in the stomach, and the other one is to push their lower back against the chair. Hold that when you see the characteristic rocking. Hold that for 5 seconds and then relax, and repeat that 12 times. Once that's done, again, go ahead and lock back the chair, lower the pressure on the lumbar regulator there, slowly unbuckle the patient, help them up and out of the system, avoiding any quick, jarring, sudden movements. With a spondylosis or stenosis, what we have in this case is that we want to avoid flexion, we want to avoid extension, as any type of extension causes that instability to move. So we also know that with an extension, then if a patient has a spondylosis, it can push the vertebral body forward. The other thing then is that with a stenosis, if you put a patient into extension, the facets slide one over the other, and it can actually close off the amount of opening within the intervertebral foramen itself and cause irritation along the nerve roots. When we're setting this up, then remember, the key point is we want to keep the patient either in neutral or forwards into flexion to again open up the intervertebral disc spaces and to put a patient into a flexion position, then to avoid having that spondy shift forward. So the main difference with this then is that once you have the patient stabilized up and in the chair, we want to, instead of doing any type of pulling to the left or the right, we're going to keep this angle adjuster straight in the middle. But what we want to do then is, instead of putting this one all the way to the back, we will keep the adjustment such that the patient is either neutral, sitting straight up, or even slightly forward, so that it pulls them slightly into a flexion position. So then once we have that, we want to make sure then that the patient is in an upright position and they're not leaning back. We'll slowly add unweighting to the unit, and again we'll go 30 to about 50% body weight, so long as the patient feels no discomfort and they can feel that mild traction going on. We'll leave the patient for about 8 minutes in static traction, checking to make sure there's no pain or discomfort along the way. Once they've done the 8 minutes, then we'll go ahead and loosen the chair with the 2 pull pins on either side, holding on to the chair itself, increase some pressure in the lumbar regulator, just enough so that the chair is sitting up against the patient without it dropping away from the patient. Ask the patient now then to do 2 motions. One is to suck in the stomach, and then the other one is to lightly, with the stomach sucked in, to go ahead and push their lower back up and against the chair. You'll see a little rocking motion here, which we call the characteristic rocking motion. Once you see that, ask the patient to hold for 5 seconds, relax, and then go ahead and repeat that. So suck in the stomach and then lightly push, 5 seconds, and then relax. Repeat that 12 times. Once that's done, push the pull pins back in, and go ahead and slowly release the regulator and start to unbuckle and release the weight on the patient and get the patient up and out of the chair, avoiding any quick or sudden motions. The last thing that we then see with patients is that we want to make sure that any patient that has a central bulge, what we're dealing with then is that in this case, we'll watch to see if there's, since they have an anterior, or excuse me, a posterior bulging of the disc right in the middle, we want to open up the front half, and we do this by bringing the patient into extension straight back. So the angle adjuster is actually adjusted in such a way that it's not going to the left or the right, but that it's actually pulled all the way back so that the patient is put into an extension position. This is where it's important that when we talked earlier about placement of the chair directly underneath the unweighting device and the angle adjuster, that you make sure that the center of the chair is placed in such that when we're doing the extension, they're truly extended. So when we are going through this work then, make sure that when you put the patient into the harness and you attach this, that as we go into the unweighting, that the patient feels no pain or discomfort as they're pulled into extension. Again, we're unweighting about 30 to 50% of body weight. If the patient feels no pain, periodically check with them and hold them in static traction in that position for 8 minutes. Once they are done with the 8 minutes, then we're going to go and loosen the chair, meaning then we're going to pull the 2 pull pins on either side, holding onto the chair, the back of the chair itself, while we start to increase the pressure on the regulator, just so that the chair sits up against the back of the patient without pushing them forward or falling away. Once we're in that position now, then we're going to ask the patient to suck in the stomach and lightly push the chair back into, or they suck in the stomach and slightly push into the back of the chair. You'll see the characteristic rocking position. Once that rocking position is seen, then we want to make sure that we will hold that for 5 seconds, repeat the entire process for 12 times. Now, some of the things that patients that you will come across that can be tips for you as you set up a patient into the chair. Remember, you need to tighten the belt as tight as you can without causing pain or discomfort to the patient when you start to stabilize the patient. In certain cases, pulling all the way to one side can cause a patient discomfort, in which case try to go pulling to 50%. If that feels better for the patient, then that's where we want to put it, and then we will work towards the end as we progress in our work with the patient. The other thing is that as we go through and start the neutral pelvis exercise, it might be easier for the patient to do the exercise if prior to starting with having them suck in the stomach and push out, we slowly release a little bit of the weight off of the patient, meaning that we release some of the traction and give the patient some of their weight back. This will loosen the cable enough that the patient can start doing their exercise. The other thing is to look out then for when we're doing the unweighting with the machine, that if you put it from exercise into balance mode, bring it back to the exercise mode so that we can again get a little bit more play off of the unweighting cable itself. Please also be aware of any contraindications that we talked about in the first session, primarily with the unweighted device when utilizing the harness or the vest. We want to make sure that any patient that has any respiratory problems do not have this as the unweighted device is or an unweighted traction is going. The other thing is that these patients should have been screened and need to be screened for any tumors within the spine that can be exacerbated by traction itself. However, these should have been checked at the very start, and this is also why it's important to continually ask the patient as you go through the protocol to make sure that they feel no pain, no discomfort, and have no problems. So make sure that the patient is monitored from time to time. At this point, we are finished and at the end of session 6. Please make sure to review all the components of this session along with the manual, and we will look forward to talking with you and continuing on to our other sessions. Thank you for your time.